Hello and welcome to Eye Insider Ophthalmology Simplified. In today's video, we are going to discuss about dry eye disease, its definition, etiology. So coming to what is a dry eye disease, it is also called as dysfunctional tear syndrome. So according to the dry eye workshop study, the definition is that it is a multifactorial disease of the tears and ocular surface. It results in symptoms of discomfort, visual disturbance, and tear film instability, along with potential damage to the ocular surface and increased osmolarity of tear film and ocular surface inflammation. So, this is a quite complex kind of definition. So, there is a simple one which we can discuss. So, that is, it can also be called as a heterogeneous group of tear film disorders, which is caused by reduced tear production or increased tear evaporation, which is associated with symptoms of ocular discomfort. Right. So we need to discuss something called a lacrimal function unit and the tear film before going to the etiology. So this lacrimal function unit includes the lacrimal glands which secrete that in the eyelids where other meibomian accessory lacrimal glands are located, the ocular surface, that is conjunctiva cornea, and the nerves, that is sensory and motor nerves, which are supplying these. Alright, then coming to the basic anatomy of the tear film. So, near the cornea, there is glycoprotein which is surrounded by a mucin layer which is secreted by the goblet cells and the glands of man. It's almost 0.2 microns. In the aqueous layer is 0.7 microns secreted by lacrimal gland. The lipid layer is 0.1 gram and it is secreted by the meibomian glands and Zeiss glands. Now coming to the predisposing factors. So age is the very important one. So along with the increasing age, there is hormonal changes and there is atrophy of lacrimal glands. And in postmenopausal women, there are hormonal changes which cause dry eyes, and there are systemic diseases like autoimmune disorders and iatrogenic with the LASIK, contact lens and medications, and environmental stress like high heat and caffeine use. So these all are the predisposing factors for dry eye, development of dry eye. Now coming to the etiology of dry eye. So we'll discuss it under the headings of aqueous deficiency, increased evaporation, and reduced wettability. So this is based on the Asia Dry Eye Society. It's divided into these three. So coming to aqueous deficiency, so this affects the aqueous layer of the tear film. It can be divided into Sjogren's and non-Sjogren's. So Sjogren's again is primary keratoconjunctivitis sicca and secondary keratoconjunctivitis sicca. And in non-Sjogren's, we have primary, secondary lacrimal gland deficiencies, lacrimal gland obstructions, reflex hyposecretion, and medication induced. So, primary lacrimal gland deficiencies include age-related and congenital alachremia, that is Rille syndrome, and familial dysautonomia. In secondary lacrimal gland deficiencies, it can occur due to sarcoidosis, amyloidosis, trachoma, tumors of the lacrimal gland, and post-radiation. Lacrimal gland obstruction can occur in case of ocular cicatricial pemphigoid, Stevens-Johnson syndrome, and burns. Reflex hyposecretion is seen in cases of neurotropic keratitis wherein the fifth nerve is involved, and corneal surgeries, and also some medications. So these medications include beta blockers, oral contraceptives, anticholinergic drugs, and the preservatives in the eye drops. So these were the etiology of aqueous deficiency, dry eye. So this secondary keratoconjunctivitis sicca can occur in rheumatoid arthritis, SLE, Hashimoto thyroiditis, and vaginous granulomatosis. Coming to increased evaporation, so this is uh, occur due to meibomian gland dysfunction, reduced blinking, and also lagophthalmos. So in meibomian gland dysfunction, there is increased number or replacement. So it can be seen in trichiasis, dystrichiasis, and rosacea. Reduced blinking, which can be seen with screen time excessive. In lagophthalmos, in case of seventh nerve palsy and proptosis. Then we have this decreased wettability, dry eye, which occurs in case of vitamin A deficiency, wherein these goblet cells are involved. Okay, so this is the basic etiology. So the aqueous deficiency involves aqueous layer, increased evaporation due to lipid layer, and the decreased wettability due to the mucin layer. Okay, so this corresponds with this tear film layers, this etiology. Thank you for watching. Bye.
Please subscribe to my channel for such informational videos. It requires a lot of effort to gather information and create such wonderful videos. Thank you.